doctor.
Most experts define infertility as not being able to conceive or get pregnant after at least 1 year of trying. Dawie, so good of you to join us on Hello Doctor.
Thank you very much.
How would you define trying?
Well, I mean, as you said, it's a year of unprotected sex, and most couples on average would have intercourse 2 to 3 times a week.
Okay, so having tried, and I'm sure you've tried, Mel,
yes.
How successful are fertility treatments these days, generally?
Yes, generally, I mean, it can be with insemination as low as 15 to 20%, but with IVF, it goes up between 25 and 40%, depending on the patient factors.
What rates of success were you given for Roxy?
I was given 25%.
Fantastic. That's great, eh? What about the age of onset in terms of dealing with fertility? Late into the 30s, early 40s. Are there some risks involved?
Absolutely. I think that age is one of the main reasons for fertility problems, because as you get older, the quality of your oocytes or eggs deteriorate. But also the risks of most complications in pregnancy increase with age. So it's not only getting pregnant, but also the pregnancy itself that carries an increased risk.
What about multiple pregnancies and fertility treatment?
It's obviously an issue with fertility treatment, and it depends on the option that you choose, because artificial insemination, where you still rely on fertilization in the tubes, you can have an increase of from the background risk of 3 in 1,000 to maybe 7 to 8 in 1,000. But when you choose IVF, where you choose how many embryos you transfer, obviously you can reduce the risk for multiple pregnancy.
And you're not at risk, Mel, because at 26 you're still fine. Yeah.
18.
Seriously though, I mean, you said I'm going to put things on hold for a bit. You're now 36.
Yeah.
How long are you going to wait until you try again?
I'm giving myself 1.5 years before I make that final decision.
Great. Final decision. Dawie, when would you suggest people stop trying, if at all?
It's a question often asked by patients, because obviously finance, etc., plays a role. But I think that the research shows that up to 80% of patients would fall pregnant if they do not choose to stop treatment. So that's very encouraging.
Gee, that should put a smile on your face.
Definitely.
So let's talk about treatment. I mean, how do you treat infertility? Broad sweeps.
Yes. I think that's very important, because patients often share their experience, and patients get different treatments. So I don't think that you should apply what you experienced to someone else. I think everybody has got an individualized treatment plan, and I think that's what people need to remember, is that for every problem there's a specific solution.
Did you find a lot of people, Mel, giving you advice and saying, this is what you must do, or what we did was?
Oh yes, at the banks, at the buying groceries, everybody knew better.
And I suppose Google knows as well, and that's potentially dangerous too, isn't it?
Definitely.
So how would you combat that, Dawie? What would you suggest to patients? If they shouldn't go to Google, they shouldn't listen to friends, is it a reputable reproductive specialist?
I think that obviously I would encourage all women to have a gynecologist who look after their gynecological health, and that includes annual visits. And then obviously when they identify a fertility problem, to refer them to a specialist, fertility specialist.
Mel, people watching in your situation, how would you talk to them now? What would you share with them in terms of having been through what you've been through?
For me, it's very important for them to not feel that the negative stigma prevent them from doing anything about it. Prevention is definitely better than cure. I think if I had done something when I was younger, I might not have been in this situation today. So really, go out, do your checkups, and look after yourself.
I know you would concur with that, Dawie.
Absolutely. So good gynae care, and when you identify the fertility problem, to be seen by someone with a focus on fertility.
Fantastic. Dawie, thank you so much. Mel, thank you for sharing as you've shared, being so open and honest about it.
Thank you.
And here is hoping that Roxy gets a baby brother, baby sister very soon.
Yes, she'll love that.
Yeah, we're hoping and praying. That's wonderful. It seems so unfair sometimes. So many committed parents to be denied a child, while many people who don't deserve to be parents can reproduce at the drop of a hat. There's no fairness, there's no answer to that, but there's always hope.
Hello, doctor.